Sophie, thank you. Good evening. Welcome to the Late Look North tonight. The public have their say on controversial plans to shake up hospital services in Huddersfield and Halifax. Our top story, campaigners and patients gathered in Halifax this evening to hear about controversial plans to overhaul hospital services. The local NHS says the way hospitals are currently organised in Huddersfield and Halifax is unsustainable, and the number of patients dying in their hospitals is higher than the average for England. They say they struggle to recruit enough staff to meet national guidelines, especially in A&E, and without making changes, the Trust will face an underlying deficit of £27.5 million. They want to move all emergency care, including A&E, to Halifax, keeping only routine services in Huddersfield. But campaigners believe patient care will be damaged and lives will be put at risk. We'll get the latest from that meeting in just a moment, but first our health correspondent Jamie Coulson has this.
Amanda Kerwin has chronic kidney disease and spends several hours a day on dialysis. She lives in Todmorden and has had to be rushed into A&E in Halifax a number of times. She's concerned about plans to reorganise hospital services, which include moving Huddersfield's emergency department to Halifax.
I feel frightened that it'll have dire consequences for me, because you've got two hospitals at A&Es at full capacity, going down to one. And I can't see that as a good outcome.
The two hospitals are 5 miles apart and currently provide a wide range of services. Under the plans, Calderdale Royal Hospital would become a centre for emergency care, including A&E, intensive care, emergency surgery and a department for very sick children. Meanwhile, Huddersfield would deal with planned care, like routine surgery, medical day cases and diagnostics, all from a new hospital site. Both sites would have an urgent care centre to deal with non-life-threatening injuries. The local NHS says something has to be done because services are no longer sustainable, and that the Calderdale Royal Hospital was eventually chosen over the HRI as the centre for emergency care because of cost, as there was nothing to choose between the two in terms of quality of care or access. Thousands of people have already marched through the streets of Huddersfield against the plans, but there have also been concerns raised in Calderdale.
We're going to end up with half a hospital each that won't be able to deliver the full range of services that people in both areas need. And the risk of overcrowding in the A&E in Halifax is quite serious.
Public opinion has partly been misinformed by scaremongers who've spread some myths and rumours about what the changes entail. There'd be a significant investment into the healthcare locally, and they'd greatly improved safety and sustainability of services.
For those like Amanda, tonight's meeting was an opportunity to seek answers to their questions. Jamie Coulson, BBC Look North.
Our reporter Heidi Tomlinson has been at that public meeting in Halifax and joins us now. What would you say the mood was there, Heidi?
Well, Harry, the best way I think I can describe tonight the mood was measured. Around 150 people turned out to the sports hall here at Halifax Leisure Centre, armed with some very well-informed questions. They'd clearly done their homework, and afterwards the panel praised them for their quality of questioning. The panel were eager to stress that this was a real consultation period and that their ideas would be taken into account, and they were encouraged to come forward with any alternative ideas they had.
Answers were given to people then at the meeting, and how were they received?
Well, there were no surprises as to the two main areas of concerns, and they were patient care and staff shortages. Broadly speaking, the panel answered those with this explanation, that by separating the services into emergency and planned, the patient care would improve because the number of doctors and nurses would increase coming to this area, because that would enable them to specialise in the area they wanted to concentrate on. In terms of finances, there were a lot of questions and concerns about the finances. They said that there was a static pot of money available to this area. That wouldn't change, but by changing the services it would mean that the money spent more effectively. The panel did admit that this is not an ideal situation, that these proposals are a compromise, which did nothing to reassure our dialysis patient we heard from there in Jamie Coulson's report.
It makes me feel very uncertain of the services that I may require and have required in the past. I've been in an ambulance under a blue light. I've had hemorrhaging at last, after surgery, and I think I'm probably their worst case nightmare patient or service user.
So what happens next, Heidi?
Well, there will be a second public meeting, Harry, and that's due to be held in Huddersfield on Monday. This has the potential to be on a much larger scale. Campaigners say that there may be up to 5,000 people there because, of course, the proposals include plans to take away the emergency cover at Huddersfield, which has already caused a lot of anger and concern.
Heidi, thank you.